All right, we can get started now. Looks like we've got some joined, and we are now live on Facebook. So my name is Hannah Fisher Mortensen. I'm now married, so my new name is Mortensen. I am the Executive Director of Physicians for Social Responsibility Wisconsin and the Wisconsin Environmental Health Network, or what we call WEHN, or WEHN, and that's where we're live streaming today. And WEHN is a group of health professionals concerned about how the public health voice is out there for environmental issues. And we have a lot of members that are concerned about the health side of environmental issues. So today we are lucky enough to have one of our steering committee members, Andrew Lewandowski, here today with us to answer some questions about the Governor's Task Force on Climate Change. And so I'm now going to turn it over to Andrew to introduce himself.
Everybody, my name is Andrew Lewandowski. I'm a full-time pediatrician on the east side of Madison. I work with Group Health Cooperative of South Central Wisconsin. And my involvement with climate change and climate change groups as it relates to human health. Hannah already mentioned that I'm on the steering committee for the Wisconsin Environmental Health Network. And in that role, I am a liaison to a diverse network of organizations that make up the Wisconsin Climate Table as well. And that's a group of probably over 30 different organizations that are dedicated to equitable climate solutions or equitable decarbonization. Other roles that I fill, I'm on the steering committee for Wisconsin Health Professionals for Climate Action, which is oftentimes called WIPCA or WHPCA in our alphabet soup of everything. And then I'm also a Wisconsin representative to the American Academy of Pediatrics Council on Environmental Health. There are 58 different climate advocates across the country who are working together on coming up with climate change solutions, especially as it applies to child health. So I'm a representative for the state to that group. So that is me and what I do.
Great, thank you, Andrew. We know you spent a lot of time advocating on the side of climate action, so thank you already for all of that time. So we're gonna get started here with some question and answers, some things I've pre-generated and some things that have been sent in. So just to start off, can you just give us the basic explanation of the Governor's Task Force on Climate Change?
Yeah, that's a great question. So a while back, if people were following the news super closely, you may have noticed that there was an executive order that was towards the end of last year, or it was sometime last year, Executive Order 38. And Executive Order 38 was essentially there to set a goal of carbon neutral electricity for the state by 2050. And then it also established an office through the Department of, through the DOA, the Department of Administration, establishing the Office of Sustainability and Clean Energy. And that DOA department is now headed by Maria Redman. And then following that, Executive Order 52 then established the Governor's Task Force on Climate Change. And that executive order to create that task force in part kind of rode on the coattails of Executive Order 38. But when you actually go to the website and when you hear what people are talking about on the actual task force, it's more than 2050 electrification, which is really heartening. People are talking about electric vehicles and transportation and heating and sustainable food sources. The actual task force, even though it's the Governor's Task Force on Climate Change, in my mind, we should really be calling it the Lieutenant Governor's Task Force on Climate Change, because the Lieutenant Governor, Mandela Barnes, he's actually the chairperson for the committee. And he does a really great job of bringing people together, and especially given that he's sort of been tasked with ideas around equity and bringing in diverse voices to all facets of our state government at this point in time. It's especially important that we're considering this as an environmental justice movement and climate justice. And Lieutenant Governor Barnes does a very good job of making sure that all the people who are in leadership positions and all of the subcommittees are very focused on that component of things, because really the two are inseparable. The task force, you can't do everything with like 50 people in one kitchen. So it's been subdivided into 3 different subcommittees. There is the Energy, Housing, and Infrastructure Subcommittee. There is the Land Use and Conservation Subcommittee, and there is the Healthy Economies, Strong Economy Subcommittee. I'm currently serving as a non-voting task force member, so I'm a subcommittee member, but not necessarily a member of the entire task force. But I'm a subcommittee member of the Healthy Communities, Strong Economy Subcommittee. So as you might assume, that really applies to health and wellness, and also evaluates what we need to do in order to make sure that we're getting into the ground floor of a lot of the economic benefits that we would see from climate change mitigation and adaptation. Energy, housing, and infrastructure, also the name sort of implies what that group is working on, as well as land use and conservation, which involves environmental groups, but then also groups like farmers, First Nations communities, etc.
So this is a question I actually just thought of based on what you said, but as a subcommittee member, what can you take to bring to the voting members of the climate task force?
To bring to the voting members of the task force. Right. So I think it became really clear that even though they had a really diverse group of actual task force members, that they still didn't have enough resources at the table. One individual that they didn't have was a clinician, for example. And when you have a Healthy Communities, Strong Economy subcommittee, and you're trying to talk about the impacts of climate change on human health or child health or public health, there are definitely important representatives like Sherry Johnson, who is on the task force from the UW Population Health Department. But having someone like Jonathan Patz, for example, who's the director of the Global Health Institute, but is also an internationally renowned climate change researcher. He's one of the subcommittee members in sort of an advisory role to that group. As a clinician who's very involved in climate change mitigation and adaptation and impacts on human health, that's sort of my role as a clinician. And so it's really just us lending our real world expertise and our networks of people who work on these solutions from day to day to sort of help the voting task force members come up with policy recommendations that are going to be realistic, that are going to be impactful, and hopefully are going to make a big change for everyone. I mean, I would say the state, but obviously climate change is not just a state problem.
Yeah, that's great. Thank you for explaining that. So you kind of hit on it a little bit, but for you personally, why is this task force so important?
So I think it's pretty clear that this is the first time in a while that we've seen any movement on climate justice. Well, actually, it's the first time we've seen movement on climate justice in Wisconsin, really. I mean, it was nice that there was an initial task force back around 2008 under the Doyle administration that came out with recommendations looking at climate change and mitigation and adaptation. But really, we haven't heard much from the legislature or from the governor's offices or really any other facets. Even the Public Service Commission hasn't really posted too much in the way of renewable energy and climate change and mitigation adaptation. And I'm really happy that the task force has been created, because this is, I mean, we're past the deadline in many ways. And when we're trying to affect a change, bringing together a diverse body of individuals to make comprehensive, sweeping changes, at least policy recommendations to allow for some of those things to happen, is super important. And so having a task force to create those policy recommendations when we are at the deadline and pushing forward those agendas is just really important.
Thank you for sharing that. I appreciate it. So with your knowledge and your background, how do you think how can people take part and make a difference and contribute to this policy making within the task force? What can people do at home right now to be an influence?
Right. So I think there are really 2 ways to answer this question. The first way is to please come to the public listening sessions, share your stories. There's so climatechange.wi.gov. is the Climate Task Force website. So you can go there. There's a section where you can click on a link that says public comment or comment, and you can share your stories. You can write things out that way. There are also links to the public hearings or the public listening sessions where you can give your feedback. Please don't feel daunted about this. It's just like a 230 person Zoom party where we're all talking about what's important to us and how we want to see things change and climate change. And there are some people who are like dressed up in 3-piece suits, ready to give their polished presentation. And then there's also like a random dude from northern Wisconsin wearing a t-shirt. And so you really shouldn't feel nervous. What's most important is just that people like the Lieutenant Governor and the task force members, and then anyone else who is listening is hearing about how climate change is impacting you, or policy recommendations that you think might be missing or should be at the table. Because we can't speak for every single community, and that's why public input is important. And I can say from personal experience talking to different subcommittee members is the subcommittees have not created all their policy recommendations and are just trying to rubber stamp things. The task force members want to hear from the community. They want to hear from you so that they can incorporate that into policy recommendations. And I know that with the political process, people oftentimes get really frustrated about that. And so you would definitely have the potential to contribute in those meaningful ways. But the other way that you can really contribute to this is really to do some of the things that we would have done even before the task force is created. Talk about climate change, talk about its impacts on human health. If you're a physician, start talking about this in your clinics. These are things that we can do. I think a lot of the times we get scared by things that have been politically divisive in the past. But really, when you look at the research, the vast majority of individuals do believe that climate change exists and do believe that it's an issue and do believe it's a problem. And so when you talk more about it, it becomes less of a taboo thing that we're kind of nervous about and a lot more of a, not is there a problem, but how do we solve this problem? And if you cultivate that atmosphere, then it's going to make it a lot easier for policy recommendations to be adopted and implemented. Because at the end of the day, a policy recommendation is exactly that. A recommendation does not mean that it will get signed into law. A recommendation does not mean that it'll turn into an executive order or that it'll get acted on by the Public Service Commission. And so we need to show a broad range of public support saying, yes, we agree with these policy recommendations. They came from us, and this is why we need to have them enacted. So it's really a combination of a lot of different factors that are going to lead to systemic change that hopefully will then affect a global change.
Well, that's great. Yes. And so we'll be posting on the WEHN website all these different ways you can contribute to a listening session or submit a comment and start talking about climate change, and in particular climate change in health and climate justice. So we've got lots of resources on our website, and we're continually posting things on Facebook. We do have a question here. What are the next steps for the task force after the public listening session?
Great question. So a couple deadlines. So, and I believe that Hannah is going to be posting this information as well, but there is a public listening session tomorrow from noon until 2 p.m. and you can get all of the information for how to join that meeting through the website I mentioned earlier. There are additional public listening sessions on the 7th of July in the evening, on the 9th of July in the evening, and then also on the 15th of July. So that'll be the first one tomorrow, obviously, is a Saturday, and then there will be a Tuesday, a Thursday, and a Wednesday. So hopefully there are a diversity of days and times that people can find a way to give input regardless of our crazy schedules. And so that's one way to give that input, but then the kind of going into that question, the end of the month, July 31st is kind of tentatively when they're looking at sort of cutting off the deadline for public comment through the website. And it's not necessarily that you can't continue to contribute, but at some point in time, the task force has to switch from collecting input to then implementing policy recommendations. And while there are certainly ways to continue to share information after that, as far as the public comment, that's really when everything is going to get compiled into a big document and then sent so that it can be considered by each of the subcommittees. So that's step number one, is getting those public comments in by the end of July would be great, and attending those listening sessions. And then it's important to note, depending on how closely you've been following, the original deadline for recommendations to the governor was going to be towards the end of August. I think it was August 25th. But, you know, with everything happening with COVID and so many things that have required the attention of our state legislators and our executive branch, they've extended that deadline. And so the policy recommendations now will be due at the end of October. So there is a little bit more time. And please reach out to any of the task force members if you have anything that you wanted to have included.
Thanks. Anybody on can also submit questions right now by commenting on Facebook or submitting them through the chat box on Zoom. But I do have one that just popped into my head right now for you, Andrew, is, you know, how you work so much with climate change and climate action. What gets you motivated to keep working on this issue? You seem to keep going for it. So for someone at home, that climate change seems like something out of reach, you know, what can you tell them?
Yeah, so there's a phrase that necessity is the mother of all invention. And I think that this is a classic case of that. When you look at the population that's disproportionately affected by climate change, which includes the elderly, children, people with chronic medical conditions, communities of color, economically disadvantaged populations. That's something that drives me, because there are already so many disparities, and to have one more thing that's widening the gap and worsening disparities for those groups is, to me, just not acceptable. But then I think the other thing is that there is a deadline. I think so many times we think about the fact that, oh, well, you know what? We're still working on this issue, and we were working on it 50 years ago, and we're going to continue to plug away at it. And then 50 years later, we're going to work at this issue, and we keep plugging away at it. And eventually we are going to hopefully fix this thing. And, you know, we're just optimistic that things are going to change. And, you know, while that optimism is needed, it's also important with climate change to understand that the IPCC guidance, as far as those 2030 and 2050 goals, they're not suggested deadlines. What they're talking about is irreversible climate cascades that come from tipping points in our climate. It's like a domino effect that you can't stop the dominoes from falling. And so we are seeing health effects of climate change right now. We're seeing people who are harmed by climate change. There's air pollution alone in 2016 was estimated to cause over 64,000 premature deaths in the United States and over 7 million people globally, looking at things like PM 2.5 or other air pollutants. And so when you're considering that that's just air pollution and there are so many other things, and then you're saying on top of it, if we don't meet this deadline, that this is going to be an irreversible cascade that our children and grandchildren and future generations have to live with, I can't think of anything that can compel anyone to want to work more day in, day out, every single day, before your job, after your job, lunch meetings. Like that's where I pull my energy from, is that it has to get fixed. It has to get fixed now, and there aren't any other better causes that you can tie these together with.
Great, thank you, Andrew. I know that you have that passion, and that's why I wanted to have that question, to kind of share that passion and the urgency for doing something right now. And I want to tell people if they can take action. They can always reach out to WEHN if they need more resources, help maybe crafting a message for the public listening sessions or anything like that. Send us a message on Facebook, use our website, use our Twitter, just reach out. We are more than happy to help. And I also want to give Andrew if you have anything else left to say, this is a good time. We don't have any other questions at the moment. So do you have any last thoughts?
No, I mean, I think that's a pretty good synopsis of everything. So just to summarize, climate change is a public health emergency. Climate health is human health. Environmental justice and climate justice is inseparable, and it is incredibly important to consider the input from diverse perspectives, to intentionally reach out to communities of color, reach out to marginalized populations, to have them at the table as we create those solutions to prevent widening the gap. And it's important for you to share your voice, and not only sharing your voice with the task force members and lieutenant governor, but sharing your voice with everyone else around you.
Great. Thank you so much, Andrew, for joining us today. I know we're incredibly proud of the work you're doing in the public health sphere as a pediatrician and as a climate change activist. So thank you for sharing your precious time today with us and our audience. And we just want to wish you well with being on the subcommittee.
Thanks so much, Hannah.
Thank you. Bye-bye.